Hi, my name is Amanda Medley. This is my head-to-toe assessment for the final project. This is my sister Amanda Mills. She is going to play my patient today. Okay. Hey, Amanda.
Hey.
How are you this evening?
I'm tired.
Tired. Alright, let's just start with your present health status. What is your current any current medications or herbs you take?
Currently taking 40 milligrams of Lovenox once daily and 1 prenatal vitamin.
Okay. Are you under any current treatment for anything?
Prenatal care, first pregnancy.
Okay. What about any allergies?
Allergic to Bactrim, morphine, IV dye, and anything in the penicillin family.
Alright. Alright, so you have any present illnesses right now? Alright, as far as your past health history, any childhood illnesses you've had?
Just chronic ear infections.
Have you had any problems with those since you've been an adult?
No.
Right. What about adult illnesses?
Asthma and polycystic ovarian syndrome.
Alright, what about any hospitalizations you've had?
I was hospitalized in November of 2008 for DVT, and I was hospitalized November 2014 of this year for possible appendicitis. Turned out to be ovarian cyst.
Okay. Do you have any surgeries?
No.
Okay, so you still got your gallbladder and tonsils and everything? Any accidents or injuries?
No.
Any chronic conditions?
Nope.
Are all your immunizations up to date?
Yes.
Have you had a flu shot this year?
Yes. I had a flu shot and also received a tetanus shot in September.
Okay. Have you ever had the pneumonia vaccine?
No.
Alright. As far as physical exams, have you had a physical exam recently?
Yes. On November 6th, 2014.
Do you know when you had your last chest x-ray?
I can't remember.
Right. Any of your prenatal visits, did they do a pap smear?
Yes, my first one on October 3rd.
Alright. What about EKG? Have you ever had any cardiac issues or EKGs for anything?
I've had one before, but I don't remember when it was.
Okay. What about TB tests?
I had one for my place of employment in May of this year.
Alright. Even though you're kind of young and mammograms start later, have you ever had to have a mammogram for any reason?
No.
Alright. As far as your obstetric history, so this is first pregnancy?
Yes.
How far along are you?
11 weeks and 2 days.
Coming to the end of the first trimester.
Thank God.
Alright, for your family history, are both parents still living?
Yes.
Right. What's their ages?
My mom is 47 and my dad is 57.
How's their overall health?
Both of them are healthy. Pretty healthy.
Alright, do you know much about your grandparents, your parents' siblings? Alright, what about any siblings that you have?
I have a brother. He's pretty healthy, and then I got a sister. She's pretty healthy.
Alright. Now we're going to talk about your nutritional status.
Okay.
About how tall are you?
6 foot.
Okay. What's your approximate weight?
341.
As your doctor talks to you about starting off with the pregnancy and watching if you lose weight, it's okay. Just make sure you're eating healthy.
Yes.
Alright, so speaking of your diet habits, let's talk about what you've had to eat in the last 24 hours. So let's start at breakfast today and just go through.
For breakfast, I had a boiled egg and some wheat toast.
Okay, what about for lunch?
For lunch, I had leftover meatloaf and green beans.
Okay, supper?
I had some homemade pizza, 1 piece.
Alright, any snacks throughout the day?
I had half of an apple and a cheese stick. There's only 1 point on Weight Watchers.
Okay. How's about your fluid intake? Are you making sure you're taking in plenty of fluids, or what have you had to drink today?
I had 2 Pepsis and 4 bottles, the big bottles of water, like Smart Waters. So probably about 64 ounces of water.
Alright. Okay, so obviously you speak English because that is what you're speaking. Is that what your primary language is?
Yes.
For reading, writing in public and everything?
Yes.
Do you have a certain religion or faith you prefer to practice?
Southern Baptist.
All right. How important is your religion to you?
Without God, I'm nothing, so it's pretty important.
All right. Do you have any special beliefs or practices that would be helpful for why we're treating you if you became ill, like such as you can't receive blood transfusions or anything like that? Anything religious that you don't want us to do or want us to know about?
No.
All right. Do you use any kind of alternative treatments for healing?
No.
All right. Do you have somebody special that you turn to whenever you are sick?
Yep. My sister.
Okay. Is it just for like moral support?
Yeah.
All right. Let's talk about your family a little bit. Do you live with family or do you live alone?
I live alone with my dog.
Okay. Do you have family close by?
Yeah.
I'm guessing since you live alone, you make all of your decisions?
Yes, ma'am. It's the best part of being on your own.
Do you have any other family members that take on any kind of roles or responsibilities as far as anything goes, or are you pretty much just on your own?
I'm pretty much on my own. I mean, as I go farther in my pregnancy, I mean, my sister and my parents will be a good support system.
Okay. It's nice to have a support system, especially with the first baby. Alright, we're just going to go through the different parts of your body to see if you have anything abnormal that you think of. With your skin, have you noticed do you ever have any skin diseases? Any unusual bruising, changes in moles, nails, hair loss, sores, anything like that?
No. The only bruising I get is from the blood thinners.
Okay. Is your stomach bruised up from your injections?
Mm-hmm. And I notice I get bruises on my legs if I bump something, so.
Okay. Have you had any change in your hair texture or anything?
No, it's about the same. It's oilier since
Just since the pregnancy, or?
yeah.
Alright. You had any dizziness, fainting, headaches, or anything like that?
Well, I get dizzy sometimes and headaches.
Okay. And as far as your eyes, do you have to wear glasses or anything? Alright, have you had any visual changes, halos, flashing lights, excessive watering, dryness, sensitivity? Nothing?
Nope.
But your ears, have you had any recent infections, ringing in your ears, pain?
Just some aches, earaches.
Some earaches. Alright, have you had any like new onset of nosebleeds, or have you had a history of nosebleeds or pain? Has your sense of smell changed at all?
Yeah. It's very sensitive.
When did that start?
About 3 weeks ago.
Do you have any sores like with your mouth, any problem with your teeth, bleeding gums, chewing problems, toothaches, frequent sore throats, or anything like that?
Nope.
Alright, have you noticed any swelling or pain in your neck or stiffness, or you have your lymph nodes whenever you get like a sore throat?
No.
Any of that stuff swelling?
Nope.
You have chest pains, palpitations, or unusual feeling of your heartbeat?
No.
High blood pressure?
No.
Low blood pressure?
Nope.
Alright. How would you describe your fat and salt intake?
My fat intake is a work in progress. It's probably too high, but my salt, I really don't use that much of it, but if I start craving it, I'll eat a little bit more.
Okay. Alright. Have you had any problems with your legs or arms being cold to touch or swelling in them?
No.
Any discoloration or numbness? Any varicose veins?
Yeah, I got a lot of varicose veins, especially on my left leg.
Left leg?
That's the leg I have my blood clot in.
Okay. Alright, any issues with your respiratory?
I have asthma and um, get sinus infections pretty easy.
Okay. You ever had any problem with coughing up blood or
No.
you're a smoker?
Yes.
Okay. I know we talked about this previously about the risks of smoking, and I know your doctor's talked with you also about it.
Mm-hmm.
So are we trying to cut back?
Yeah, currently I use the patches. They seem to be working for the most part, so hopefully that will be the answer to my quitting smoking.
And hopefully your family will support you and help you out as much as possible also.
Right.
All right, with your gastrointestinal and your stomach, do you have any issues there?
Just morning sickness right now, which includes
Just
nausea, vomiting.
All right, no diarrhea or change in appetite?
As far as appetite, I don't eat as much in one sitting, but I eat more often.
Okay. That's not always a bad thing as long as you're eating healthy things. All right, move on to urinary. I know being pregnant sometimes you have to pee more often. Has that happened yet, or have you noticed any changes in your urinary system?
Yep, and it likes to wake me up at least twice in a night.
So more often. Any pain with it? Okay. Alright, do you have any pain in you with your joints, muscles, anything like that? Cramps, swelling?
I get cramps in my rib cage sometimes, and my lower back hurts a little bit, but other than that.
Alright. Have you ever had any seizures or change in your memory?
No.
Paralysis, hallucinations? Not like that?
Nope.
Alright. Have you had any weight change recently?
Just gained 4 pounds in the last 11 weeks.
Okay, probably that could be due to pregnancy too, and just kind of watching what you're eating and being more active. Any change in your skin coloring anywhere?
No.
Alright, describe what your exercise pattern looks like. You do daily or weekly? Do you get much exercise?
Well, I do a lot of walking in my work, and it's not just like casual walking, it's brisk. Get to where you need to go, vice versa.
What do you do for work?
I am a corrections officer at a prison.
Okay. How are you feeling right now about your education?
I would like to go finish my bachelor's degree, but I do have my associate, so that was an accomplishment.
Yeah, there's always time for that. How do you feel about yourself when it comes to your financial status?
I'm not broke, I just got poor cash flow.
Okay. Are you feeling okay with that, or is that something you feel like you need to work on, or?
It's life. I'm American. Will always be in debt.
Alright. How do you feel about your own values and belief systems? So you're confident in that and feel very positive about that?
Yeah.
So you're able to perform any of your regular activities of daily living independently? Do you need any help with anything?
Right now, I'm perfectly fine, independent.
Alright. How's your sleep patterns?
Disturbed. I can't remember how long ago it's been. I got a full 8 hours sleep without having to be woke up, but I guess I'm very used to that.
Do you take naps during the daytime?
At work or at home?
Well, hopefully at home.
Yeah, at home.
So after work?
Yeah.
Yeah, about how long are your naps usually?
Sometimes it ranges from like half hour to sometimes 4 hours. Get up, go to the bathroom, get a drink, go back to bed for the rest of the night.
Right. Using these kind of sleep aids?
Nope.
Alright, as far as interpersonal relationships, how do you describe your role in, like, amongst your family? There's like equal member of your family, or spokesperson of the family, or how would you describe?
I'm pretty equal to everybody, but I do voice my opinion when it needs to be voiced.
Alright, what about amongst your friends?
Oh, I'm probably the leader. Party!
What about at work?
I'm a leader.
Alright. Let's talk about coping and stress management. Do you have any perceived stressors?
People who nag me, like always want me to do something, or just they can be selfish and not realize that I have a busy schedule. But another pet peeve is people who disrespect people, whether it be me or somebody else. That's probably my biggest pet peeve.
Okay. What kind of stress relief methods do you use? Or do you have any stress release?
Well, I typically address situations so it don't boil and eventually make me want to erupt into anger. But normally talk to them, or I keep a journal. I write in a journal a lot.
Okay. Does it seem to help you pretty well?
Yeah, or I sing in the shower.
That's the only place I'll sing, so no one can hear me. Alright, you already discussed you use tobacco. Any alcohol or street drugs?
Negative, negative, and negative.
Alright, as far as your environmental health, is there any occupational hazards?
There's always the risk of not being able to go home at the end of the night. Whether it may take your life, or an accident happen where you have to go to the hospital. In my case, because I'm on blood thinners, if an inmate were to hit me in my head or my chest, I could hemorrhage. So,
is your employers taking precautions for that to try and prevent some of that from happening?
yeah, they put me on what we call desk duty.
Okay. Do you have any safety precautions at home?
Not really. I mean, it's my home, so I don't really
you feel pretty safe there?
Yeah, safe.
What about in your neighborhood? You feel safe in your neighborhood?
I feel safe in my neighborhood.
Alright. When you're traveling, do you take safety precautions while traveling?
I wear my seatbelt. And I carry a Glock.
Alright.
And I carry mace.
Alright. We're just going to go into a little bit of a general assessment. Okay? I'm just going to look at your skin over a little bit. Just flip your arms over. Okay. Alright.
That needle hole was from IV.
I believe it.
Okay.
I have one myself there and there.
Okay,
so.
this is from when I was in the hospital. The night you was in the hospital. Okay.
Okay, just looking at your skin, see if there's any kind of changes, dryness.
It's dry.
Like a little bit of dryness. Just check your capillary refills. They're all good, less than 2 seconds. I'm just going to feel on your hand, make sure there's no lumps and stuff like that, okay? Everything looks good there. No swelling. Sorry, I didn't mean to tickle you.
At least your hands ain't cold.
No, they're not cold.
The nurse the other night, her hands was cold.
Alright, normally I don't have any smelly bottles here. Normally here with checking cranial nerves, we do the cranial nerve 1 is olfactory. I have her close her eyes and check the smell of a bottle of something, but I don't have anything here. So I'm going to assume that
Pepsi.
your smell, you said, has been working okay, just a little more sensitive here recently. For the optic nerve, I don't have a smelling chart or any of the other tools that we would use. But you do okay with vision and all that? Mm-hmm. Okay. I'm going to start back here. Tell me with my fingers.
I can see this one and that one.
Okay. Bottom of finger. Okay. This checks for the accommodation. Just go in like cross-eyed, like making faces.
Did I go cross-eyed?
A little bit.
Oh yeah.
Okay. Check some of your other cranial nerves. Can you clench your teeth? Okay. I'm just going to check here, make sure all your muscles are kind of contracting. That all feels great. A little paper over here. Okay. No way to check some of the cranial nerves. I don't have a paper clip or anything with me either. I was obviously not very prepared. But I would take the dull or sharp end and just touch on forehead, cheek, and chin and have her differentiate if it was the sharp side or the dull side. Can you smile? Frown. Wrinkle your forehead. Okay. It's all perfect.
What if that adds another wrinkle to my face?
It will be fine. Oh. Okay, as far as a hearing test, I don't have the tools to look in your ears to make sure there's no redness or anything behind them. But if we can have quiet in the room, please. Can you hear the noises? Mm-hmm. You hear Aya? Mm-hmm. Mm-hmm. Okay. Alright. I don't have a tongue depressor either to check the gag reflex or swallowing. I'm assuming you're able to swallow and everything good.
Good.
Perfect. Alright. We would use a tongue depressor to look in her throat. And use that also to check the gag reflex to make sure everything is working right with the cranial nerves. Alright, can you stand up for me for just a second?
Ugh. They got comfy.
I'm sorry. Just have you shrug your shoulders. Put them down. Right, can you shrug your... Okay. And then you turn your head. Okay, can you push your head side to side and see each... Okay. Perfect. Alright, stick out your tongue. Move side to side. Okay. Another way to test that is have a tongue depressor to hold it and make her push her tongue against the resistance of the tongue depressor, which I don't have. Alright, you're gonna put your arms out. Alright, can you close your eyes and do the...
Oh, want me to get my head straight?
Preferably, that's fine. Okay, you did fine with that. Alright, you're okay with squatting? So all your muscles are working pretty good?
Mm-hmm.
Okay, stick your arms out. You push up. Okay, you push down. Alright, you can have a seat. Kind of the same thing. Okay. Push your leg against my feet. Okay, go back. Okay. Just gonna take a listen to your lungs. Take deep breaths. Okay, just gonna listen to your heart.
Is it beating?
It is beating. That was perfect. Alright, if you want to lay back, just listen to your belly a little bit too. I'm gonna leave you covered eyed. Okay. I'm not gonna push real hard because I don't want to hurt a baby. If you have any tenderness or anything. Alright. I think that is about it. Muscles all seem fine. I don't have the proper tools to look in your eyes, in your nose, or any of that kind of stuff.
I got a flashlight. You want to see my eyes?
Yeah, that was the other thing I actually had to forget. So I want to thank her for reminding me. I lost my pen light too. It's been a busy weekend. So I'm going to use her flashlight on her phone to check pupils.
You actually said it. I just asked if you want to use my flashlight.
Okay. Pupils are equal and responsive. Another one of the tests you can use for one of the things is have her look up and away. Use like a cotton swab to touch the whites in her eyes. Both eyes should close bilaterally. All I have is regular Q-tips. I don't want to stick something in her eye that's not sterile, so I'm not going to do that test here. So I don't have all the right instruments as far as looking at her optic nerve and retinal in her ears or in her throat. I'm sure I've missed something, but this is about as far as, or as much as I can think of right now.
Just look over and make sure. Take your time. I'm a good coach too.
Okay. I think I've covered just about everything. If I've forgotten anything, I apologize. Thank you for your time. We've had a very busy weekend around here, so we're getting this done late. But thank you for your time, and thank you for watching.
Thank you.
Bye.